Hi, I'm Dr. Jonathan Spages. I put these videos together to help people who are diabetic or maybe suffering from diabetes or know someone with diabetes. I've been reversing diabetes for over 10 years with thousands of patients, and I take a whole different approach. And maybe something I mentioned in this video could help you or a loved one. So I want to go over something very interesting today, and it's about exercise and diabetes. All right, and let's talk about the typical diabetic story that most people unfortunately have to go through when they get first diagnosed as a diabetic. On day one, most people do not know they're diabetic. They go to their doctor, they're getting a routine physical, and the doctor comes in and says, listen, Mr. Jones, Mrs. Jones, I have some bad news for you. You're diabetic. No sooner do they say that before they go, they grab their script pad and they go there and they start writing their first script related to diabetes. Typically it's metformin. It's not always the medication, but typically it's metformin. They give some recommendations. They say first, change your diet. Okay, so maybe if you're eating junk food, don't eat junk food. All right, maybe if you're drinking alcohol, don't drink alcohol. Right, common sense things, nothing too specific, just common sense things. Okay. The next thing they recommend is go exercise. Right, maybe go lose some weight. Okay, these are the basic things that are told to you. So take a medication. Right, take it once a day or twice a day, whatever. Go lose some weight, go exercise, and change your diet. Okay, that is pretty much the only recommendations given day one as a diabetic. Okay, now most people take their diabetes serious, but the one thing I really want to emphasize is the exercise part of this. Okay, so they're told to exercise. Now, because I do something called functional medicine, and functional medicine really looks at the root cause of why someone's a diabetic, right? So I look at why someone's a diabetic, not just the fact that they are diabetic, right? Diabetes is a symptom. It doesn't mean that that's the cause of the problem. That means that there's something else broken in the body and it's a symptom. So anyway, I want to really figure out what's causing that person's diabetes. And the one thing that I found out when I run really, really comprehensive labs is you really got to get down to the basis of what's there. Okay, so when I run blood tests, okay, doing functional medicine, I don't run the standard of care testing, right, which is a basic panel. It's your CBC, your complete blood count. You have a lipid panel, which is your cholesterol levels. Usually you have a basic metabolic panel, right, which looks like your blood sugar and everything else, right? Maybe you get one or two more tests, a vitamin D here or there, an A1C, things of that nature. But honestly, it's not a lot. It really isn't. It may be for someone who is unfamiliar with healthcare, but literally to really figure out what's going on, you have to really dig. And I run typically about another 33 more tests beyond those tests I just mentioned. I mean, you really have to look at what's happening to really figure out what's causing someone's diabetes. And the thing I'll tell you, which is kind of a secret, is there's no one reason why someone's a diabetic, okay? And that's really the truth of it. There's no one reason. There are many reasons why people become diabetic. But anyway, the point I'm trying to make with this exercise is that there are particular things to look at in blood that actually show some people that they should not be exercising if they're a diabetic. And what I mean by that is not like, yeah, they could walk and maybe they could like swim, but I'm saying like in terms of strenuous exercise, lifting weights, strenuous things like digging holes or lifting heavy bags, some diabetics should not be doing that, okay? So the way you figure it out is through very, very comprehensive tests and labs. So I know sometimes that everybody gets this one-size-fits-all approach when they get diagnosed as a diabetic of take your meds, watch your diet, whatever the hell that means. I don't know. I don't even know what that means. Does that mean like, hey, I'm watching my diet? I literally had their plate, I saw food, I got a fork, I put it in my mouth, I watched my diet. Sorry for the sarcasm, I am from New Jersey, but I'm saying like watching diet is a little bit more comprehensive if you really want to reverse a disease condition. So anyway, watch your diet, exercise like I just mentioned, and then lose some weight. Okay, so the exercise part is what this video is focusing on. So like I said, some diabetics should not be exercising. Okay, so anyway, I put a whole entire webinar together explaining my approach, giving you some tidbits about what you or a loved one can do if you have diabetes and what to do to actually reverse it. Okay, so check out the video. I hope you enjoy the video, and I hope you get a lot from it. And that webinar is a really, really good training. At the end of the webinar, it also talks about how to work with me one-on-one. You have to be invited in to be a patient of mine. I don't accept all cases. And there's a reason for that. All right, so anyway, I hope you enjoyed this video. Hope you got something out of it, and have a great day.